but your family member isn't awake, please don't compare your and the other patient's recovery because both the patients are different. Once you reach the hospital, you are the eyewitness to tell the emergency doctor yes, what these details really matter for the emergency doctor as well as the other doctors who are going to see him. Hi, I am Siddharth. I am working as an advanced neuro rehab specialist here at PRS Neurosciences. In this video, I am going to tell you about what would your experience be if, God forbid, you have to take one of your family members or friends to the hospital who has a stroke for admission. The first and foremost, most important thing is to understand is a person who is having a stroke is in a state of distress and they are looking forward to people around them who can help them to remain calm until they reach a good healthcare facility where proper neuro care is available. In that situation, remaining calm as a caregiver is of utmost importance. Once you reach the hospital, you are the eyewitness to tell the emergency doctor what was the problem because of which the patient became either unconscious or lost some functionality or is under distress. For example, if a person who became unconscious and fell down versus a person who fell down and became unconscious, these details really matter for the emergency doctor as well as the other doctors who are going to see him. There are other cases where the family member has become unconscious at home, maybe late night or after having a dinner and he has gone to the washroom and fainted and fallen down. In these situations, it's very important to immediately call for an ambulance without delay. Please don't wait for them to get up by themselves after some time because you would lose precious time in that case. As soon as you reach the ED, make sure you clearly tell what has happened to the doctor and be ready to answer some questions which they want to know to decide what is the course of action. Do they want to do a scan? Do they want to do emergency blood checkups? Or do they want to call a specialist right away? Will be the call of the emergency doctor. Allow them to perform the test based on their medical experience without interfering in the process to save the precious time required for the brain to heal. So, once the doctor in the emergency department is sure that it looks like a stroke and he has called in for a neurologist initially to come and evaluate if it's a stroke or not, the neurologist will usually suggest certain specific blood investigations which are markers to determine if the brain has undergone a stroke. Also, they ask for imaging tests like MRIs or CT scans. Initially, a CT scan tells them decent information, but if the CT scan shows that yes, there is a stroke in the brain, they need to go for an MRI. MRI usually will be more expensive, so important to carry some extra cash or a card with you so that that procedure doesn't get stopped and there is no delay in the investigation process. Apart from that, there are certain medications which are started right away to help in preventing the clotting of blood or breaking down the blood clot which has travelled and caused the restriction in the blood flow. If by chance in the scan it shows up that there is accumulation of blood or the blood has collected in the brain which should be in the vessel, ideally in the artery or the vein, the patient usually needs an emergency surgery. These surgeries includes either putting in a tube inside the brain to drain the blood out or actually physically opening the skull and removing the blood clot which is compressing on the brain and causing dysfunction. Please remember, as the stroke keeps evolving or the blood keeps leaking inside the brain, there is neuronal loss. In easy words, the more time you take to decide and to support the doctor's decision, the patient is at a higher risk of losing his functionality and quality of life. If the stroke is limited to one side of the brain, usually you will see the patient regains consciousness sooner after the episode of the stroke. If these people have undergone a surgery which still limits to one side of the stroke of the brain, or it has not gone deep enough to affect the centers which regulate your consciousness, they will still be awake, and more often than not, half of the body will be responsive. Please remember, if the stroke is on the right side of the head, the weakness will be seen on the left side of the body. Unlike injury to the leg or hand, where the problem is in the limb, here the problem is in the brain. So, the rehab has to happen keeping in mind how the brain recovers. For that, we require proper neuro rehabilitation, which includes different professionals coming together. Usually, this team consists of a physical therapist, an occupational therapist, a speech language pathologist who also takes care of swallow therapy, cognitive therapist, proper nutrition, prevention of all complications like pressure sores, prevention of any unnecessary joint stiffness, early mobilization, which is really successful in retraining these people and getting back the functionality. So, this is the array of services you get from neuro rehab. There are people where the stroke, because of the massive size of the stroke, it starts compressing the other half of the brain as well, and it starts compressing downward, making the patient unconscious. These people, they take certain duration of time to regain their awareness of the surrounding, and the recovery may or may not be similar to those who had a early high level of consciousness after the stroke. So, please understand, if you see another person who is in your ward, who is awake, but your family member isn't awake, please don't compare your and the other patient's recovery, because both the patients are different. Even if the injuries look alike, these two patients are completely different. For more stroke related information, stay tuned to this series, and thank you for watching.